Hi, and welcome to Insure It Forward. Today I'm going to show you how easy it is to do their online quoting tool using their website instead of healthcare.gov. From personal experience, I've spent over an hour trying to figure out healthcare.gov and going through all the problems of their site. I even didn't get done with my application. So instead, using the tool that's on insureitforward.com, we should be done in about 7 to 10 minutes. Be sure to have all of your documentation and information needed, like social security numbers for all of you and your dependents, and that will make the process go a lot faster. Start off by going to insureitforward.com. Again, insureitforward.com. I'm here on my computer, and I'm going to go to the tab now that says Get a Quote. Middle of the page, one of the main links, Get a Quote. Click there. On this page, you'll scroll down just a little bit, and you're going to see a big title, Find Your Health Plan Now. Just put in your zip code. I'm going to put in 73134 for Oklahoma City, and Find Plans. Click the button. The first step on this page, who needs coverage? It's going to have just their age and whether or not they're a smoker, and below there's a blue button where you can add additional people. Just add until you've added enough people for all the coverage that you need. I'm going to leave it for 1 to keep things moving for this instructional video. The next is get lower prices. You may qualify for subsidy based upon how many dependents you have and your annual income. So for this, I'm going to put a household size of 1 with an annual income of $30,000 to keep things simple. It automatically pops up another option here. Box 3, your results. It shows that even though it's just one person making $30,000 a year, they qualify for a small subsidy of $3 per month. That number will change based on dependents and income. The next area, we can actually look at the plans. We can sort by different options. We can choose by the insurance companies. We can change by provider types. There's all kinds of different things that we can filter our criteria for. We'll start here at the top. In these areas, it has the name of the plan, the monthly payment, and what's in blue already has the adjustment for the subsidy. Below it shows you what the price would be without the subsidy. Shows you the deductible per person, the types of service, and whether or not you'd pay for these types of services. You can click on the Compare button and the Details button to learn more information. It's always best maybe to click on the Compare on a few that you might be interested in, and you can see side by side which ones would be a better choice for the coverage you need. If you still need further help, don't be bashful. Call Insure It Forward and they will help you out. The representatives are very eager to make sure that you pick the right plan. Since your window for applying can be very short, you want to get it right. You don't want to keep making mistakes and then maybe stuck with a plan that really isn't benefiting you for an entire year until open enrollment comes back. So to keep things simple, we're going to click on the first option here that says Enroll. And now we just put in our applicant information. So I'm going to put in John Doe with an address of 123 Main Street. Keep things simple again. In Oklahoma City. If your mailing address is different than your home address, be sure to click this box and put in the correct mailing address. This way you get your correspondence to the right place. Below now, be sure to put in your email address and phone number in case there's any other questions about your health coverage. At the very bottom, there's a box here that says Apply for Lower Prices, and it's already checked. Because I chose the option on the previous page to look into lowering my costs, the box is automatically checked because I'm looking for subsidy to see if I qualify. We're going to leave that box checked and hit Next. On this page, you may have to scroll up a little bit, depending on how many dependents and where the screen falls. But now we're choosing who is going to have coverage. If you need to add additional people, here's where you're going to add additional names and information for each. For time's sake, we'll hit just one person. Applying for coverage, we'll check the box that says yes. And now I put in my information. You need to add in gender, birth date, social security numbers, and you'll need social security numbers for all dependents, including yourself. Be sure to check the boxes that apply to you. On the right, you will need to put in your tax status for 2015, and I'll put that I'm single and I'm filing my taxes. The next area, I said I made $30,000 a year. I need to put my sources of income. You may have just one, you may have multiple, and you enter them here. I'm going to put $30,000. Select the source. I'm going to put my job. there's other options here. Be sure to put what applies for you, whether it be self-employed, Social Security benefits, etc. And name your employer or the name of the source. And then put in their contact phone number as well. There's a button below here that says Add Income if you had additional sources. The next is your existing coverage information. Have you already had insurance? Does your employer offer you insurance? Some of these other questions you might not know the answers to, and if you need help, again, reach out to one of the representatives at Insure It Forward. They will help you. I'm going to put that I'm not already enrolled, and that my employer does not offer this, and that did not get rejected by Medicaid or CHIP since October 31st of 2014. If you had lost coverage, this is where you put the date of when you'd lost coverage. Right now, we're in open enrollment, and so you can apply without any issues. But outside of open enrollment, which ends on February 15th, you'll need to have a special qualifying circumstance. Otherwise, you'll have to wait until open enrollment again on November 15th. I'm going to hit Continue. If I needed to, there's a place to add additional people for income and information. This is the Confirm and Sign. Again, you may need to scroll up a little bit on the page, but you want to hit that you agree to each of these statements or you will not be able to proceed. Be sure to read them. And then hit Submit. On the right, there's also a summary of what we chose. And the next page says, Congratulations, sit back and relax. Everything's done. Also, it has the phone number for Insure It Forward and your confirmation ID. This way, if you've got questions, they can quickly pull up your information and further help you in the process of applying for health coverage. Pretty simple. Took us less than 10 minutes, and I'm even giving you instructions through the process. So, much easier than healthcare.gov. I strongly recommend it. If you need help choosing the plan or have further questions, reach out to Insure It Forward. They're very eager to help you, and know that all of their services are at no additional cost to you. Thanks for watching.